Hi everyone, welcome to 𝗖𝗵𝗵𝗺. We are discussing hepatobiliary and pancreatic system, and today the topic is the parasite, and the parasite is Echinococcus. Okay. Now in this video, as you must have watched, I'm going to tell you a little bit about the amoebic liver abscess and these nematodes like Fissiola and Echinococcus. Okay, but let me tell you, my dear friends, the only reason why I have mentioned the name of these two topics, amoebic liver abscess as well as nematodes, Fissiola and Echinococcus, the only reason is that you should know that whenever you are reading hepatobiliary pancreatic system, you should read these topics also. But we have already discussed these topics in our previous video. The link of these videos will be provided to you in the description. Okay. So, in total, the most important topic or the only topic of discussion for this video remains Echinococcus granulosus. Okay. So, Echinococcus granulosus, if you know, the definitive host is going to be dog. Echinococcus. So, word echino means what? Echino means dog. So, it is a tapeworm, dog tapeworm. Okay. Now, this dog tapeworm is responsible for release of hexacanth eggs. Okay, responsible for the release of hexacanth eggs, and the intermediate host or the dead end host or the accidental host is man. Okay, so the larva formation is going to occur in the intestine, which is carried to the liver. Then the larva then forms the hydatid cyst, which is the characteristic lesion called as the hydatid cyst. So, if I form cycle, so how the cycle works, please understand, you have got dog, the dog is going to lay down the hexacanth eggs. So, hexacanth eggs means like 1, 2, 3, 4, 5, 6 spokes are there, hexacanth eggs. This is going to enter, hexacanth eggs is going to enter into the intestine of humans, where this egg is going to get converted into larva. Now, this larva is going to go to the liver of the humans, and in liver it is responsible, the liver it is going to form what? Hydatid cyst. Hydatid cyst, which is the characteristic lesion of Echinococcus granulosus. So, how will you diagnose it? Please remember, which is very, very important, hydatid cyst is seen in the liver biopsy. So, if you are taking a liver biopsy, hydatid cyst will be seen in the liver biopsy. You can do CT scan, you can do USG, you can do MRI. Okay. Skin test, there is a skin test which is called as Cassoni's test. Now, remember C, D, E, F important. Leave F, but C, D, E are important, or rather E, F, G, H also. Okay. So, what is C? C for, remember, Cassoni test. C for, remember, cyst. Which is the cyst? Hydatid cyst. Okay, we can remember it with the H. So, H for which cyst? Hydatid cyst. D for dog tapeworm we are talking about. E for, it is also called as Echinococcus granulosus. Okay. And H for one more is going to be hexacanth eggs, which is the infective form, hexacanth eggs. Okay, you got it? Yes. So, till now you got a mnemonic to remember the things. Now, we will understand more about Cassoni's test. So, Cassoni test means the antigen from the hydatid fluid. So, how the hydatid cyst look like? Let me just draw a diagram for you. For example, this is a hydatid cyst. You will have scolex. You will have scolex like this, and it will be full of fluid. Okay, it will be full of fluid, and this fluid is called as hydatid fluid. This fluid is called as which fluid? This fluid is called as hydatid fluid, my dear friends, which is along with this is called as scolex. Okay. So, you will take the antigen from the hydatid fluid. Okay, the antigen is taken from the hydatid fluid. When it is applied to the skin, it is responsible for causing the wheal and flare reaction. Whenever you are going to apply it on the skin, it is going to show a wheal and flare reaction. So, two more things which I would like to tell you. See, the definitive host is dog, intermediate host or accidental host or the dead end host is going to be man. So, this is also important for D, that dog, and the dead end host is going to be the humans. Okay. One more host is also there, some books write, some books don't, that sheep is also the intermediate host for them. Sheep is also the intermediate host for them. Okay. So, coming on to the content, I have already told you this is the 𝗲𝗃, the head of the larva, and the hydatid fluid which is there. Now, since you are aware that the hydatid fluid is having the antigen and the hydatid fluid is very risky, it can cause anaphylaxis. That's why the procedures like biopsy are not done nowadays. Biopsies are not done because it may puncture the hydatid cyst, and once the cyst is punctured, it may cause the anaphylaxis. That's why we are not doing it. So, what it is going to cause? Obviously, because there is a cyst which is growing in the liver, it is going to cause hepatomegaly. The size of the liver will increase and there will be pain in the right upper quadrant that is going to happen. Okay. Now, this cyst can even reach to your brain, and in brain it causes altered sensorium. Okay. If it is going to reach the lung, it causes the pneumonia-like features. Okay. Pneumonia-like feature. So, how will you treat it? Remember, the drug which is given is the praziquantel. Very importantly, please remember the cyst should not be burst. Even if you become a hepatologist or any doctor, but please remember, don't burst the cyst. Okay. Because if the cyst fluid is going to spill, it is going to do severe anaphylaxis and patient may die on table itself. Then what to do? You should have to do pair technique. Okay, pair technique. Now, you are not bursting the cyst, you are just doing a little puncture. Just like in order to inject something, some dye or something in the veins, we puncture the vein. We don't burst. Okay. So, puncture the cyst, aspirate all the fluid out because that is the most riskiest part. Then you will instill some 𝗲𝗏𝗋𝗃 agents. So, you are going to kill the head of the larva. Okay. So, kill the head, that is the 𝗲𝗃, right. So, kill the head of the larva, the 𝗲𝗃. Okay. And once the larva is killed with the albendazole and silver nitrate, they are very important, albendazole and silver nitrate. Again, you are going to reaspirate, the mnemonic becomes pair. So, this is called as pair technique and this is the management. So, just a simple diagrammatic representation for you to see the dog, okay, the definitive host, the dog is going to release the embryonated egg in the feces, and this is going to go into the humans. So, basically accidentally it is going to go in the humans, in the liver, in the lungs, okay, like that, and the 𝗲𝗃s are going to attach to the intestine, adults are formed and the cycle is going to continue. That is why humans are considered to be the dead end host, okay, because the cycle is going to continue. Humans are dead end host. Otherwise, the usual cycle is between the dogs and the sheep gods in them. Okay, see here the hydatid cyst, you can see the hydatid cyst has reached where? It has reached the brain. So, here it can cause the altered sensorium and other features. Okay, so this is the hydatid cyst which has reached the brain. Okay, so hydatid cyst is itself very important, and there are different classifications basis on the basis of which stage this cyst is, but those classifications are more dealt in the subject of surgery. So, if you are reading this topic right now and if you are interested, you can go and check out. But from my side, from microbiological point of view, I will take your leave because this is the end of the Echinococcus granulosus dog tapeworm, and this also finishes our hepatobiliary pancreatic system. Thank you.